name is Dave Rakel. I'm the director of the University of Wisconsin Integrated Medicine Program, and here today with Mike Johnson, who's going to teach us a very valuable technique, particularly in primary care for people with headaches, sub-occipital pain, and neck pain, called the Sub-Occipital Release.
Hi, my name is Mike Johnson. I'm a certified athletic trainer as well as a certified massage therapist here at the UW Health Integrated Medicine Program. I've been studying bodywork as a massage therapist for the last 8 years, and I've been doing manual therapy as an athletic trainer for about 23 years now. The technique that we're going to do today is called the Sub-Occipital Release, or just occipital release. And it's pretty much a universal technique that is found in just about every form of manual therapy out there that I've come across. This is an area that is a very commonly tight and congested area on many people. The posterior suboccipital muscle group is very thick. It can be easily 1 to 2 inches of muscle tissue and mass of soft tissue in this area. And it's very commonly going to be a tight area on most people. And so the technique that we're going to do is going to help soften the soft tissue in that area, the fascia tissue, the muscle tissue, help open up the space between the atlas and the axis and the base of the cranium, the occipital base, and create more space where many vital structures pass through that area. The area that we're going to be working with today is the area between the base of the occiput, C1, the atlas, and C2, the axis. And it's right about on her hairline here. It varies on most people exactly where the hairline is, but as she lays on the table, we'll work our way up till we find the base of the occiput. Then we'll slide back down just a little bit, and as we put our fingers up into that soft tissue, we should actually feel the spinous processes of C2, and that's what we're looking for. And in our palpation, we may not be able to feel it right away because there'll be so much density in the soft tissue, but we're going to be in the area of the spinous processes of C2 is where we're going to put our finger pressure when we do this technique. So when we do this technique, when you have a patient on the table, they're going to be supine on the table. You want to make sure that their head is far enough down the table so you can completely rest your whole forearm on the table. If you have their head way at the end here, they're going to have a hard time maintaining it, and you're going to get tired because your arms won't be supported. So it's real important to have your whole forearm on the table. Then what we're going to do is we're going to start at the upper thoracic, lower cervical area and just do some gentle massage, soft tissue mobilization up the cervical spine on the lateral side of each vertebra, just to soften, relax a little bit. And as you start to work your way up, you'll eventually get to the base of the occiput. When you feel that bony ridge, then we're going to take our fingers and slide back down just a half an inch to an inch, depending on the person. And that's where we're going to put in our finger pressure up into that suboccipital space right at about the level of C2 spinous processes. The position of our hand is going to be in this. Once we work our way up the cervical spine, find the occiput, then work back down to the C2 level, we're going to basically cradle and put finger pressure up into that suboccipital space with our fingers in this position so that the C2 spinous process eventually will be resting on the 3rd and 4th fingers. We're going to start by putting our fingers in the upper thoracic area and work a little bit up to the base of the occiput, just doing some light, gentle massage, soft tissue, relaxation, mobilization techniques. Very gentle, very easy, just to get the person to relax a little bit and start to find our way up to where we want to actually put in the finger pressure to help release the suboccipital space. So a little bit of gentle massage, soft tissue mobilization. Eventually I'll get to the point where I feel the bony ridge of the occipital base. And what I'm going to do again is I'm going to go slide down towards the feet about a half an inch to an inch from there, and I'm going to put my fingers into this position, and her C2 area will be resting on my 3rd and 4th fingers. So her head will actually be off my palms initially. It'll be up in the air on most people because of the tightness and the thickness of the tissue in this area. Then all we do is wait, and we let the weight of the person's head and neck put the pressure on our fingers up into that area. And as the longer we do it, the more the tissue will soften. And as the tissue softens and releases, their head will start to slowly drift back and end up resting on my palms, and my fingers will eventually end up going further up into that suboccipital space, eventually contacting the C2 spinous process. So this is what it looks like when I actually do it. I'll get her head and just let your head go. I find the base of the occiput, which is right here. Then I'm going to go down just a little bit, and I'm going to tent my fingers up into that space, which lifts her whole head and neck. And I'm just on either side of the spine. And her head and neck is resting on my third and fourth fingers now. All the pressure is right on my third and fourth fingers. The base of her, back of her head is not touching my palms right now. It will be in a little bit. As she softens and releases and relaxes, her head will fall back slowly. And we just continue to keep that gentle, steady pressure up into the suboccipital space, just below the base of the occiput. The key with this technique is really to be slow and gentle but consistent with the pressure. You want to maintain the pressure over time. The longer you go, the more it will release and soften. As she's starting to now, her head's starting to come back, the tissues are softening and releasing. So in actual treatment, I may stay here for 5, 6, 7, 8 minutes on some people, even longer. Depends on the person. Given the fact that this is more of an instructional video, we'll shorten that a little bit today. And so the way to end the technique, once you've gotten a full release, is to relax your fingers and let their head just rest in the palm of your hands, and just do some gentle, light tractioning towards the top of the head. And you do this long and slow. The longer you do it, the better, as long as you're not trying to force anything. You can't pull so hard that they resist you. That's going to be counterproductive. You want to just do a gentle, light traction towards the top of the head to open up that upper cervical area and posterior suboccipital space as much as possible. Anytime you finish a technique like this, you want to take your pressure out slowly. You don't want to just let go and have any rebound effect. So gently release your pressure, and then once you're not providing any traction, just gently take your hands away. And patients will love you for it. I think it's very commonly known these days, we're becoming more and more aware of how important it is to address stress and where we hold stress in our body. And in many people, the upper cervical trap area, shoulders, neck is a really common area of holding of stress in people. Creates all kinds of tension and tightness and lack of range of motion. So this type of a technique can really help counteract a lot of that and get the person to open up that space and really feel what it feels like to be relaxed in that area, because many people walk around very tight and don't even know they're tight and stiff in that area. And so this is a great way to let them experience what it feels like to relax and open up, and then they can maybe help maintain that as that awareness is increased about what's going on in their body. So I want to thank our wonderful model, Alicia, for volunteering to help us out today.